fascinating.
Yeah, that was, and it was such a great, just like superficial page, like one, like cannabis endocannabinoid system 101. And I
Yeah.
love the framework she put her. I was hoping she would. I mean, I kind of knew, and it's like I told that story about that nurse at the health conference that we encountered. That the other people kind of around her were like, oh geez, she says
Right.
some crazy wild things, and
Taboo.
I don't know, I don't know, maybe, but it just seemed the topic in general. So I love that that Carey presented it in the framework of the endocannabinoid system that we're not even taught about in nursing school or med school or any allied health profession.
Which is
Really,
shocking.
yeah.
It's shocking that that's not a part of the curriculum. Sounds like it should be. And certainly some schools are starting to do it when you hear about her and all her
Yeah.
Avengers. Um, but even that there's a stigma today is just still just so shocking to me. I mean, it's just shocking,
Oh, well, yeah,
you
it's
know?
not it's not shocking. Well, for me it's not shocking because we have a whole generation that grew up in prohibit I mean still like the remnants
Yeah,
of prohibition, and you got to read Chasing the Screen.
I know. Yeah.
If you've never read that book, and
No.
I got it on audiobook, and it's like watching a documentary or listening to a documentary. I recommend that for anybody to really understand the legalities and of the Schedule 1 stuff. And it was really, I mean, I know it was one book about one guy, and I'm sure there were other factors, but it can be traced to this one guy
Yeah.
who had a traumatic experience growing up with drugs. So he thought it was evil, and got into a position of power politically and just wrecked it for everybody else. I mean, there's, there's a dark and a light to everything. You can
Sure.
abuse cannabis, but, and
Sure.
again, that's why I like how she presented it. Um, and I think another reason that people aren't that interested in going down the rabbit hole about cannabis, because it's such a specific thing. Oh, there's so many other things that I can help my patients with. Why even focus on that taboo kind of thing? But the way she presented it is the endocannabinoid system, and cannabis is one mere way to upregulate that system for the health benefits
Right.
and mitigation of symptoms. It's just I'm excited to talk to her again and get that textbook.
Well, and I think still too, when you look at the system and how it's structured, right? Like the healthcare system is more times than not probably going to recommend pain meds, right? Not
Yeah.
cannabis.
Yeah.
And it's just a vicious circle because that's what they're taught, that's how they're incented. It's the way the system has monopolized it at this point. So, but it's just still interesting when you look at what we've learned about pain meds and the addiction level today versus cannabinoids. You know what I mean? Like a much safer route to go and probably as effective. So, but hopefully we're getting there. You know, it sounds like we're getting there on the education side for this.
Yeah,
Maybe not
absolutely.
the financial, right? You know, we still got to let people make a better choice for patients, and it not be about financial.
It just should be a tool in the toolbox. I mean, it's the
Yeah.
opposite of when you have one tool, one hammer, and everything looks like a nail. This is like the opposite of that. This is like it's but one tool, and you know how to use many tools to upregulate the same system if you learn about the endocannabinoid
Say
system.
that 5 times.
Yeah,
And just say endo.
that was, yeah, but that was great. I'm sure everyone will enjoy that. Welcome to the RNegade podcast, a revolutionary approach to continuing education for nurses who don't just do what they're told. We're shining a light on the pioneers, the change makers, the renegades who are blowing up the boxes that the rest of the world is still trying to think outside of. On today's episode, we have Dr. Carey Cadieux. She is an endocannabinoid expert, not just cannabis. And we're really excited for nurses to listen to her. By the way, you can get a continuing education credit for listening to this podcast with Dr. Carey Cadieux, who is a wonderful RNegade introduction to cannabis, the endocannabinoid system. She's written a textbook. She's got this crazy, awesome background. She's a great delivery mechanism, approachable, credible for this information. And any nurse, even if you aren't interested, you will be after this. There might be a rabbit hole in your future. Everybody enjoy Dr. Carey Cadieux. I know I'm going to get us started because I want to tell you a little story. When Wendy and I went to the health conference in Las Vegas, and there's this big nurse innovation pavilion, and there was a nurse there that she didn't have her own booth, but she had an autodidact about all things cannabis and medical cannabis and everything like that. And I just kind of stood back and was fascinated because I know there's so much research going on, not just about cannabis, but all of this, things considered Schedule 1 illegal in the past, and all of the miracles that are happening with ketamine and psilocybin, and in addition to cannabis. And this nurse was still kind of a pariah, even though it's well documented the medical benefits. And I'm like, everyone was kind of like, and it's not even a very strictly conventional medicine, allopathic medicine, health conference. I mean, this thing is huge and still. So
Yeah.
I'm sorry to jump right in, but I was really looking forward to speaking with you today, because somebody who's come so far in educating nurses and the medical professional in general, I kind of just perused your background and your work, and let's just start with your take on it. Actually, let's start with why you. Why did you take a why is this the hill that you decided? Because you must have faced a lot of challenges in developing your passion.
Yeah. So I used to be married to a man who was a musician. And we followed the Grateful Dead around. So I wasn't naive about cannabis and other plant entheogens and that kind of realm of medicine. But I became a nurse in 1994. I did sort of the usual route of working like in a medical surgical unit, and then moving into hospice after a few years of experience. And somewhere in there, I started teaching. And I didn't know much about cannabis, but I knew that it was, great for a lot of things. But I didn't really know why, but I also didn't really care. When it when it came up for vote in California to be medically legal, I supported that. I voted for it. But when I was working as a hospice nurse, we were out in California. We were told, if you see cannabis at the bedside, or you have like any knowledge of the patient using cannabis, like just ask them to put it away when you're there. Do not document it, because they were afraid they would lose their federal funding, and never ever suggest it to a patient for their palliation at their end of life.
And what year is that?
I was just going to ask that.
Yeah. So I left hospice around when my daughter was born, so 2005 even. So
Wow.
even 20 years ago. So it had been medically legal in California for quite some time at that point. But there's an interesting thing where people think that hospices or other facilities will lose federal funding because of the sort of Schedule 1 nature of cannabis. It's never happened, by the way, but people still think that. So I had an opportunity to move from California to Maine. I moved to Maine, and I was kind of like, okay, I know there's a lot of cannabis in Maine, but where is it? I don't see it. I was used to being in like San Francisco, Sonoma, dispensaries everywhere. You walk down the street and you're smelling it, right? And it was still only medical in both states. And I didn't see any dispensaries. I was like, this is really weird. Where's this culture? And I took a job at University of Maine at Augusta. And I started a holistic RN to BSN program there. And so I had a chapter of American Holistic Nurses Association that we ran on campus. And the students were in charge of it, really. I was there just like their supervisor. And they brought this doctor in. And the doctor was talking about caring and compassion and holistic approaches. And I was like, wow, this guy is great. And so afterward, and it was a snow day, so we'd both brought our young children. It was a snow day for the other schools, but not for the university. So anyway, we'd both brought our young children, and they were hanging out. And he said, well, what I really do is I'm a medical cannabis doctor. And I was like, oh, you have to come back and talk to us about medical cannabis. So this was Dr. Dustin Sulak. And he did come back and talk to us about medical cannabis. And he talked about the human endocannabinoid system. So really, that's the system that we make our own cannabis-like substances. It helps us to maintain homeostasis. When we don't make enough, we might need to supplement. We might also get sick if we don't make enough of our own endocannabinoids. And when he explained it, and he went pretty deep into the physiology, I was just like one of those blown away minutes, like or moments. I was like, oh, this is why cannabis is good for, chemotherapy induced nausea and vomiting, and helps people with MS, and helps people with Parkinson's disease. Like, now I get it. I understand. And it was just, and I kept having him come back and talk. He probably spoke like 3 different times in my classes and on campus. And he said, you really seem to be into this. I was like, I love it. I was kind of learning about it on my own on the side. He said, you do know there's an organization for nurses. I said, what? He said, yeah, there's a organization called the American Cannabis Nurses Association. I was like, oh, I'm going home and I'm joining that. Turns out, who knew, there was a 501c3 not-for-profit professional nursing organization that was focusing on this. So I went home, I joined. There was a conference called Patients Out of Time that is actually still in place, I believe, and is run by one of the founders of ACNA and one of the people in nursing that came before me, Mary Lynn Mathry. And not all, but a lot of the cannabis nurses were going to be there. It was in Maryland. So I went and I met all these other nurses. And I started talking to the president of the organization. She said, I have a board opening and I can appoint someone to it. So I got on the board. I started the research and education committee with that group. And then they needed a new president. And I ran and I won. And we're going to all these Oncology Nursing Society asked me to come and speak. That was like 2017. And then they sent me out to a bunch of like regional conferences so up until like the pandemic started, I was going out to different, mostly Oncology Nursing Society, sometimes other groups, usually local chapters. They'd fly me out. I'd talk for a couple hours and I'd leave. And then when the pandemic happened, that kind of slowed down. But then I was at a professional, there's a group called the Nursing Organization Alliance. So they're a group that doesn't oversee, but interacts with and supports, like there's over 100 professional nursing organizations, and probably half of them belong to the Nursing Organization Alliance. So I was at one of their conferences, and there were some book companies there. And so I spoke with a couple of them. One of them actually connected, and this was probably 2018 or 2019, probably 2018. And we got the ball rolling on getting a textbook written. So it took a couple years. We worked through it a lot during the pandemic. And the textbook is called Cannabis, a Handbook for Nurses. And you can find it on Amazon. I know people are maybe not using Amazon so much anymore, so you can go straight to the Wolters Kluwer is the publisher. And the National Council of State Boards of Nursing in 2018 put out a document that says this is what nurses need to know about medical cannabis. And they have 6 essential areas. So the textbook is based on those 6 essential areas that the NCSBN said we need to know about. So it's kind of a great overview if people are interested in diving deeper into the topic.
Well, this podcast is just going to kind of write itself. Can you give us, you give us an overview? Because my next question obviously is, what are those 6 areas? And that'll get us to the end. I imagine. So you've done this before, Carey.
Yeah. So the 6 areas, I don't have the list in front of me, but it's all about knowing about the human endocannabinoid system, the pharmacokinetics and pharmacodynamics. So how does cannabis interact with our own body? That's important to note. Side effects and adverse effects, we have to know that. We have to have a good handle on, because cannabis is still a Schedule 1 at the federal level. And by the way, I don't see that changing really anytime soon. I always say I could be surprised, but last year people were talking about it. I was like, it's not going to happen. And there's reasons for that. But anyway, so we have to know about sort of the legality at the federal level, but also in your state. There's like 1 or 2 states. Idaho's a big holdout where like absolutely no CBD, no medical cannabis at all. And then there's, of course, some that are still really restricted. Like Texas is super restricted on who can use it and how they can get it and where they can get it. And then one of the things that I like best about, so it's like, you need to know the physiology of how it works, the adverse effects, the pharmacology. You need to know your federal, state, local laws. And then the one I like best is the last one, which is the nurse shall basically approach the patient without judgment for their choice of palliative medicines, right? So, and when I say palliative, some people think, oh, end of life. I want to clear that up. Like palliative medicines or any medicines that we need if we have, an illness that we need to palliate or care for those symptoms and manage the illness better. The book is actually, though, 9 chapters long. And so it starts with a history, because I think that's really important. So it starts with a history of medical cannabis, goes way back to, ancient China and Egypt. And I'm not sure if Germany is included in there too. They had some goddesses that were cannabis aligned, I guess is the way to Egypt also had some
cannabis friendly goddesses.
Yeah, also had some goddesses. So anyway, so it goes back in the history and kind of gives you a timeline. Like, how did we end up here? Cannabis is a medicine that has been used for thousands of years.
Yeah.
Generally, it's a safe medicine. There are of course, some caveats to that. And that's why it's so important for us as nurses to learn about it. And how did we get it to be like this evil weed type of thing, right? How did we get into the reefer madness era? So it gets into all that, provides you a good timeline, and brings you up kind of through prohibition and then where we're at today. What I call up the era we're at today is post-prohibition. So, the federal government has kind of pretty much left it up to the states to decide what they're going to do with it. So you have some states, most states that have some kind of medical, a good portion of states also have adult use. So we're kind of moving into what I call this post-prohibition and an era of regulation, right? So how are we going to regulate this medicine? So states are doing it now. Maybe someday we'll get to the federal level. And if and when we do, it will be great, because in theory, things are a little nutty right now at the federal level, but in theory, eventually there would be funding to study more closely how cannabis works and how we can really move toward using cannabis and its components. So the whole plant is got a lot of different components in it that are therapeutic and can work with our endocannabinoid system. So how we can use that. So let me jump back though. So it has the chapter on the history, and then it has a chapter on the endocannabinoid system. So this very, very complex system. And it's a very rich and meaty chapter. So for those of you that love physiology, you will love. You'd love that chapter then. I kind of feel like, okay, when I got it, and I could refer to that chapter when I need to figure out, all the different receptors and so forth.
Exactly. That's what I was going to say. Once you know what the receptor does, you can say what the therapeutic benefits are. You can also say what the side effects are. So Wendy, do you know about the pharmacology and the receptors? Like in nursing school, when we do our pharmacology thing, it's set up. I went to the University of Michigan. I remember the big pharmacology exam. Everybody was cramming to memorize this, did this, and all whatever. I and the nurses who are pathologically curious, like I am, I wanted to learn what the receptors in the body did. Because if you know what the receptor does, then you know when that receptor is activated by a chemical, either a native chemical to your own biochemistry or one you bring in that is similar or the same, right? If you know what the receptor does when activated, you can tell. You don't have to memorize anything. All you have to do is know what that receptor does. And that's a great way to learn about cannabinoids and the pharmacology of it and the side effects and the adverse reactions. And I think for the purposes of this, because you're such a wealth of information, and I could talk to you for about from everything from the politics of it to the history of it. I love the history. Have you ever read the book Chasing the Scream?
Yes.
Yeah, that book. If you've never read that, Wendy, it's like, oh my gosh, it was like one dude who vilified drugs, the therapy, and wrecked it for everybody. But for nurses who are attracted to this podcast and to you and your history, and almost maybe there's even some that are afraid to ask, who are curious and afraid to ask about it. Yep. I'd love for you to go into the pharmacology, maybe kind of the good, the bad, and the ugly in reverse order, because you've given us the ugly already, like the state and federal and the politics of it. And it's some states are friendlier to looking at it as this is something that nature gave us, and it's been used throughout history for all these therapeutic benefits. And you can argue that this one guy wrecked it for everyone before prohibition and after. But for nurses, we've gotten the ugly over with. I would love to know in your own order, like kind of like what you're bursting at the seams to let nurses know what you think is most important to dispel the taboos about it. And also, most importantly, end with what it does for patients, and as much as, because, I know we only have you for a limited time. So prioritize what you share with us by what you're just busting at the seams for nurses to know.
Yeah. So when I've gone out and talked to nurses, I feel like there still is a lot of thirst for knowledge. When I first started to go out, like at the beginning of when I started going out to Oncology Nursing Society chapters, I'd say, who's heard of the human endocannabinoid system? And it would be like nobody. This last fall, I went to an oncology nurse navigators conference. I said, who's heard about the human endocannabinoid system? And it was like a quarter of the people. So we're definitely making headway there. But I think it's so key, because I've had people come up to me after conferences and say, I came into this very skeptical. I thought, here comes this stoner nurse. Which I have been called many times without anyone ever even asking me if I've used cannabinoids myself. But anyway, I thought, yeah, this is gonna, like, I thought I'd be like, whatever. And you changed my mind. And I'd be like, well, what changed your mind here about it? And learning the human endocannabinoid system, learning that our body makes our own endocannabinoids that help to keep us in homeostasis. And the main two ones are anandamide and 2-AG. But there's more, but those are the main two ones that you'll hear about. And those two endocannabinoids interact at the cellular level with our endocannabinoid receptors, mainly CB1 and CB2. Again, a whole bunch more. So THC, which we Delta 9, you probably have heard of it, right? It's the one that's so evil. So it tends to interact with CB1 receptors. And CB1 receptors are found in great concentration in the brain. So that's why when you ingest THC, you get that feeling of feeling maybe pleasant. Sometimes we use the word high. Sometimes we use the word elevated. That's because the THC is interacting with those CB1 receptors in your brain. And then CBD, which is the other big cannabinoid that kind of like everybody knows. By the way, there's over 100 cannabinoids, and they all do some really amazing things.
Wow.
Yes. So CBD tends to interact with our CB2 receptors. So CB2 receptors are all about anti-inflammatory, right? So they help to decrease the inflammation. There's a few of those, there's some of that in the brain, but they're really concentrated throughout the immune system and throughout the body. So that's why when people ingest CBD, so they might feel a little better because there is some interaction going on there with the brain. But it's really that it's interacting at those CB2 receptors that are throughout the whole body. And it gives us this answer of why, why it can help with pain,
Pain management.
and CBD is an amazing cannabinoid. But as I said, there's over 100 more. And in the cannabis plant as well, there's also terpenes. So if you've studied aromatherapy at all and know anything about essential oils, they interact with our limbic system. So we have that going for us in the plant. And then there's also flavonoids in the plant. And so if you know anything about nutrition and flavonoids, flavonoids are extremely important for our health. And they also help support the health of the endocannabinoid system. So like I burst at the seams at that, and then I burst at the seams that there are also other ways you can upregulate your endocannabinoid system. And I really encourage people to like start there and then see if from there they want to, need to add in some cannabinoids as well. And so how do we upregulate the system? So one, of course, is decreasing our stress. So it's easier to stay in homeostasis. Adding in those flavonoids, super important. Let's also add in some omega-3 fatty acids because they need to be in balance with the omega-6 fatty acids. And most of us have too many omega-6 and not enough omega-3 fatty acids. And so you can get that from, like flaxseed, from fish oil. But did you know that why it's in fish oil is because the fish eat the algae? So you can bypass the fish and just get vegan omega-3 that's just from the algae.
Cool.
Yes. Other ways you can upregulate the endocannabinoid system are exercise. So you might have heard of the runner's high.
Yeah.
I'm a jogger runner, have been most of my life. Usually it takes 2 or 3 miles for me to even start to feel good. And we used to say, oh, it's endorphins, and you'll still hear that. And there are maybe some endorphins, but really that's the anandamide, right? So that's the your own body making its bliss molecule called anandamide, which is from the Sanskrit word ananda, which means bliss. Yeah.
So breath work is another one because anandamide.
Yeah. And so then there's other things you can do. You can do, when you leave like the massage table or the acupuncture table and you feel so good, you leave a yoga mat and you're like I say, unless you get hurt or something, no one ever regrets going to a yoga class, right? Because you feel so good afterward. And that's because you've upregulated the endocannabinoid system. And there's also some studies that have looked at things like groups of women that sing together. And those women have showed an increase in anandamide when they are singing together. So there's
drumming.
Or like humming.
Drumming, chanting, prayer, those things that we really think of as like, oh, those are holistic modalities. They upregulate the endocannabinoid system. So now we have this this crossover. So with holistic nursing, so I'm also an advanced holistic nurse board certified, and cannabis nursing. And there is definitely some alliances there. I have a chapter in the Holistic Nursing Handbook that talks about cannabis as a plant entheogen. So, and then I would say the other super important thing for nurses to know about is the medicine is safe, but it's not without its side effects and adverse effects, right? So there are certain populations that likely should not be using cannabinoids, and usually it's the THC that we worry about. And so, but sometimes it's the CBD. So if patients are on, a blood thinner, they should be really cautious. And, if they're on a medicine that they need an INR checked, it should probably be checked, as scheduled, because it can cause some issues there. Anyone with cardiac disease, again, being really cautious, maybe very low or no THC, but again, there's so many other cannabinoids that they could benefit from. A side effect of THC is tachycardia. So we would want to be just real cautious with cardiac patients. There is also some data, it's kind of mixed, about potential for having myocardial infarction, particularly in men, goes up around that hour or so after they've inhaled cannabis. So, it's mixed data still. There's also though data to show that cannabis can be really good for the cardiac system. So
Yeah.
again, one of those areas that we need to research. Pregnant women probably should not use THC. That's pretty much the recommendation that's out there. And we still just don't know enough about the other cannabinoids. So it is somewhat risky. On the other hand, are women using cannabis when they're pregnant? Yes. Why are they using it? Because they feel like crud, because they have hyperemesis gravidum. It's tough being pregnant. And then we would really want to, if they're going to use it, we really want to support them in a harm reduction way, using the very smallest amount possible, and seeing if they still would need it over time. Because people are going to do what they're going to do. Of course, my official stance is like, don't use it when you're pregnant, right? Because that aligns with all the professional guidelines. And then I have this realistic stance of like, people are going to use it. What are we going to do to support them to use it, as safely as possible with the lowest amounts of THC possible? Children. So children, if there's a medical need, like there's some good data to show that kids that are getting chemotherapy will do much better if they use some cannabis and they have that palliation, and they're able to sustain getting their full treatment instead of quitting earlier. But if there's not a medical need, and a lot of kids will turn to it because they have anxiety, social issues. It feels maybe safer than alcohol, which it is safer than alcohol. Nobody's ever overdosed on cannabis that has led to deaths. Now, there are other ways that may be associated with deaths related to cannabis, like someone gets cannabis hyperemesis syndrome and they can't stop throwing up and they dehydrate and go into organ failure. That's kind of the main thing that I see with leading to a death with cannabis use, but you can't technically overdose with it.
It sounds like a lot of the side effects and cautions about cannabis, as well as the benefits, all are individually dependent on the person who's using it, their nervous system, how their nervous system interacts with the cannabinoids. Because I can see how you can have like anti-inflammatory effects are great for your cardiovascular system and your heart and da da da. But if you have the nervous system that THC will increase and you're putting an extra load on an already taxed heart, then so it's really,
it is,
you got to play with yourself.
it is really individualized. I do want to just jump back to the kids real quick.
Yes,
there's some good data to show that kids that use high amounts of THC over long periods of time, they are at higher risk for mental health issues.
Yeah, I was going to ask
So
you.
I've with my own kids, I've like, if you can put it off until you're 25 and put off drinking and all those things until you're 25, when the brain is fully formed, you're going to be all the data shows that if you don't use during those late teens, early 20s, highly unlikely that you'll have addiction issues or mental health issues from a substance after that. So I think that's super important to consider. But it is an individualized medicine, which is really, really cool. I think a lot of other medicines should be more individualized. We really encourage patients to self-titrate. So for them to figure out the amount that's going to work best for them. And there are some guidelines. They're in the textbook as well. Dr. Dustin Sulak, who I mentioned earlier here in Maine, he has a great website, and it's called Healer, HEALER.com. And he has the titration.
Wow, how do you get that?
Yeah.
I don't know. It's amazing. And he has titration guidelines there. He also has guidelines for people that have used cannabis for, a while, and maybe it's not as effective, or they're not liking the side effects. So they can follow his guidelines, which is basically kind of doing a washout period and then just very slowly and gradually reintroducing some of the cannabinoids as well. So, what a cannabis nurse would do is kind of walk a patient through those guidelines, educate them about products, and support them to use this safely and effectively.
Do you feel like there's more? I feel like with the original cannabis, there was hardly any side effects. Do you feel like there's more side effects today because now we have this whole medical intervention? And I feel like you can go into the stores and talk about being overwhelmed. It's like a diner menu, right? You look at it, you're like,
Cheesecake Factory.
yeah, Cheesecake Factory.
Disneyland.
Like, I have no idea.
Yeah.
But it seems like since medical intervention, now we have medical marijuana, is there more side effects today because of how it's being made?
Well, I think, I think people are using more, right? And so they're with the legal issues, people are no longer so scared to use it. So people are also assuming that it's safe, which it is when it's used effectively. We always say, kind of the lowest amount of THC is important. So those are kind of compounding factors. And then there has been a movement in producers to sort of create higher THC products. But I also want to say higher THC products have also been around, for a while.
Right.
So maybe you were in college and sitting around the campfire or whatever with your friends and passing a joint around, and you could keep passing it and you could smoke all night and you were maybe a little high. So it was probably a low THC, what we call chemovar. You'll also hear it called strain. We've always had like hash, so the concentrated oil from the cannabis, been around a long time. So people have been using that for forever as well. Thai stick. There have been some strains that came out of Jamaica, the Northern Lights in Alaska. Like all this stuff was around at least in like 70s, 80s, 90s, maybe even 60s. So, I just think probably more people have more access to it. And to be clear, to THC, so CBD, we run some risk with blood thinning, and that's kind of the main thing we get concerned about. That CBD, other than that, is really very safe. But THC is how we get all the side effects. It's really from the THC. So another thing a cannabis nurse would do is really, and you mentioned like, these dispensaries, right? You go in and it's like, oh my God, it's Disneyland for adult use cannabis in here, right? There's soda, there's popcorn, there's brownies, there's cookies, there's gummies, there's joints, there's, a quarter, an eighth. Like, what are we doing here, right? So another thing a cannabis nurse can do, and fortunately, a lot of these dispensaries now have websites too. So a cannabis nurse can really coach the patient to like, what are you interested in trying? What are your goals here? Let's look at the different kinds of cannabis medicines that are available at this dispensary, and let's go in with a plan, right, for what you're going to try.
Right.
And cannabis is also expensive. So that's a big concern. Your insurance is not covering this palliative medicine. So how are you going to pay for it? So that's another thing that a cannabis nurse can help a patient with to budget and figure out like what's going to be most effective with them, and also encourage them to keep a cannabis diary, which is like, think of like the pain diary, right? Not something the patient has to always keep forever. But while they're figuring out what's going to work for them individually, they can, and the textbook has an example of this, but, the date, the time, what product they use, how much, like what was really in that product, if they know, and then the effects, and then any side effects. And if they're kind of tracking that, then the cannabis nurse could sit down with them. So we can always educate as nurses, and we can always coach. And cannabis nursing is now recognized as a subspecialty by ANACC, American Nurses Association Credentialing Corporation. So ACNA, American Cannabis Nurses Association, is working closely with them. There is an actual scope and standards of practice. So I wrote the first scope and standards of practice, and then co-wrote the second one that added in the advanced practice nurse role. And then there's the finalized one that a lot of people contributed to. So I think it came out really great. I did some final editing and contributing with that as well.
Nice.
Can I ask back to the textbook? I love that you presented in a way. Well, I love two things. I love that you talk about the cannabinoid Say it
And
again.
endocannabinoid system.
The endocannabinoid system. It's just like holotropic breathing will get you to the same place that psilocybin or LSD or whatever. And I love that you talk about the system, and you don't have to take, you can, that's just one way. It's 10,000 keys that all open the same door, that you can get all these benefits without actually taking the cannabis. So people have that your focus is on educating about the system innate in the body, and how much of the textbook kind of gives you the physiology and the receptors and all that of the cannabinoid system, endocannabinoid.
Right. So we started with the history, the endocannabinoid system. It's 70 pages just on that. Then there's a pharmacology chapter, which I love. I also happen to be co-author of that chapter. And there's a story about it. I can tell it really quickly, but I was looking for...
Yes, but don't tell it quickly. I just want to... Okay. You're a great storyteller. You present science in kind of a story-like way, which is pleasant, but I want to hear your stories too.
So here's this textbook. I had the deal. We signed all the paperwork. I found all my authors. I wanted all the authors to be nurses, right? It's a textbook about the essentials for nurses. I wanted it to be nurses, but no one wanted to write the pharmacology. Like, people were willing to do the ECS, endocannabinoid system, but no one wanted to write the pharmacology. I said, well, I'll find a pharmacist. Found a pharmacist. Drafts were due. And he literally, when they were due, he's like, sorry, I have some family things going on. I didn't even start it. It's not going to happen. And I was like, oh my God. Like, we're talking, the textbook is, it's 9 chapters, it's like 700 pages long, or it's a big thing. Right. So, even though it doesn't look that big, it's tiny print. So I, started looking around for another pharmacist, and I found a group of pharmacists out of a university in Florida that had done some research around cannabis and cannabinoids. So I contacted them. They lined me up with someone who was a fairly new professor, and I spoke with her, and then we had some of her doctoral students working on it. So I thought they were doing like this project and it would all be good. And what they handed me was like, I was like, oh my God. My nursing students could do better here. My beginning nursing students could do better than what I have here. And I said, I can't accept this. And I also don't have the time and energy to help coach you around how this should be written. So I'm, in my kind of real life, I'm a teacher, and I work with nursing students from RN to BSN up through PhD. And then I was like, well, guess what? Nurses are going to write this. So I called up my bestie, Rachel Parmalee, Dr. Rachel Parmalee now. And I was like, and
shout out to Rachel.
Shout out to Rachel. She's so I'm past president of American Cannabis Nurses Association. Like, all the presidents, in almost all of them are either in the textbook or they helped write for it. Nice. So she's she's the immediate past president. No, she's 2 presidents. Anyway, and she now teaches down at Old Miss in their, they have a medical cannabis program that's mostly for pharmacists. But anyway, I called her up. I was like, we got to do this chapter. And so we put it together, an outline. And actually, we also brought in Denise Foster, who's the current president, Dr. Denise Foster, who's the current president of American Cannabis Nurses Association. And it's my favorite chapter. It was like the hardest to do. We wrote it during the pandemic. So summer, weekend, during the pandemic, like, what are you going to do anyway? There was literally, in 2020 summer, there was nowhere to go. And so we'd meet on a Google Doc on Saturday morning and we'd start working together. And the chapter is great. It, it talks about supporting patients. It talks about how cannabis works in the body. It talks about other cannabinoid medicines, right? Because there are some medicines that you've probably heard of that are cannabinoid medicines, right?
Like what?
Well, so we have some herbal medicines, right? So echinacea interacts with the endocannabinoid system. Copaiba is an essential oil. I think I said that right. It works a lot like CBD. Mm-hmm. And actually, I use Copaiba topically. I have some arthritis in my thumb. because it works, and also because it's cheaper than cannabis or CBD oil.
Mhm.
And that you can find, we'll give a company like iHerb might have it. I don't know, but some essential oil companies
Mhm.
have that. Um, and then, of course, we have some synthetic cannabinoids as well, right? That can be prescribed. And why is my mind completely blanking right now?
Well,
It'll
It'll
those
come
are
come
back.
to you.
those are three categories, and it'll come
Yeah.
back to you.
Right. So
Yeah.
yeah, it will. And I'll be like, why couldn't I think of that? So anyway, so it covers like all these different cannabinoids in there and interactions and how to support patients as they learn to self-titrate and they figure out what doses work for them. So it's a great chapter. We even have like visuals of different kinds of cannabis in there and charts with the absorption and how long it lasts and those kinds of things. So that's a great chapter. And then so that's my favorite chapter. We have a chapter just on CBD. So the time that we were writing this, like CBD was exploding, right?
Mhm.
So I have another friend who is one of the past presidents of ACNA, Eileen Konechny. So she was the one that brought me in on the board and suggested that I run for president after her. And so anyway, she also has a book about CBD. And so she kind of took some things from the book and, formulated them so that there's this chapter just on CBD. We have a chapter just for advanced practice nurses. And that was written by Eloise Thiessen, also a great friend of mine, and also
It's
one
like
of
the Avengers or something.
yes. So she's the past
It's the
president.
Cannabis Avengers. Yeah.
She's the past president of ACNA. She used to work in her own private practice. Now she works for Stanford in their with their palliative patients, supporting
Nice.
them to use cannabis safely and effectively. Um,
Nice.
so she has a whole chapter in there just on the advanced practice nurse. And then we have a chapter on the nurse's role. And I wrote that chapter. Oh, and we also have a chapter on the latest research. So at the time, so the National Academies of Science, Engineering, and Medicine in 2018 or 2017, they came out with a document that basically showed this is how we know where cannabis is working, where it's, there's evidence. Like chronic pain, there is solid evidence that cannabis can be effective in managing that.
Mhm.
And then we have moderate evidence, then we have limited evidence, and then we have no evidence. And they went through in this, and this document is free. You can look it up. National Academies of Science, Engineering, and Medicine in 2018, they wrote about medical cannabis, and you can download it for free. So it's a great overview as well, like what we knew at that time. But as we're writing this, I'm like, has anything changed since then? We're writing it in 2020. So we did an updated chapter. And I think that was Rachel again, and me, and another good friend of mine, Dr. Barbara Ochester. And we went through all the categories that they had and then looked at some of the latest evidence that was very current, like 2020, 2021, to kind of update people on that. And then we also have the role of the nurse. And that includes all the holistic things in that chapter. So the cannabis nurse really is a holistic nurse, right? Because they're supporting the patient to upregulate their endocannabinoid system. And then they're, supporting them to use cannabis safely and effectively. I can tell you another story about that. So I have,
Yeah,
so
like we've gotten a great like page 1, chapter 1,
yep,
overview of
yep,
how a nurse can approach
yes.
cannabis. And to me, the summary is the endocannabinoid system. Like look at that, learn that, and then you'll see the plant as a single tool, but there's
Right.
all these other ways. But you really empower nurses with when you understand that system, you can advise and educate your patients on how to upregulate to achieve this effect, whether or not you use the plant
And for
itself.
every person that is using it, we really do encourage them to do all the things, to change their diet, to get some exercise, to have some kind of practice, because it will allow them to avoid adverse effects. If they're upregulating their endocannabinoid system, right, it's easier to stay in homeostasis. So the idea is also they will use the least amount of cannabis for the most effect and the most benefit without having those adverse effects.
Mm-hmm.
Now, the story I was going to tell is about my third cousin. So she's older, she's in her 70s. She's a quilter. So she's an amazing quilter, like her quilts sell for big bucks, right? So she goes to these quilting conventions. So she goes to a quilting convention, and at one of them, she has problems sleeping. And all of her friends are like, "Oh, you should really take gummies for sleep." So she kind of became convinced that she needed some cannabis gummies for sleep. She said, "But I thought I would talk to you about it first." And I was like, well, how is let's look at your sleep hygiene. Like, she actually sleeps great. It's just occasionally when she travels. No other issues. She's on like no other meds. She's doing really well. She's happy. Um, she's healthy. And I was like, I don't think you need cannabis. I said, if you have problems sleeping when you're traveling, let's try some L-theanine. So L-theanine is an amino acid that's great for supporting relaxation and sleep. And if that doesn't, and maybe some chamomile tea, like with maybe some passion flower, like let's put that little package together and try that. So before you need to dip into the cannabinoids. And so, it is just, again, that really individualized approach. And just because somebody has a diagnosis that's like, oh, we have evidence cannabis can help, we need to look at them individually, and really help them decide, figure out what their goals are, use motivational interviewing tools, and really help them make this their own path, right? And help them to decide. And one of the challenges right now, too, is that patients are using it, but nurses and doctors are not educated about it.
Right.
Yes, that's what
right?
that was my main takeaway at that health conference, because I know I've read a lot of the research, and I know like because it's like a rabbit hole that I'm not deep down, but I've just kind of been, loitering around the edges, and just, every once in a while, what's going on? I actually applied to California Institute for Noetic Studies because I was going to go through their program to be a researcher for the psychedelic thing. It was just because I was so deep down the hole, like, this is amazing. And what
I
am
actually graduated from CIIS.
Oh, wow.
My PhD is in humanities from there. So
That's so cool.
yeah.
I would love to some other time pick your brain, because it's still in the outskirts. I'm still loitering around the edges.
Yep.
But the amount of research and proof, like, and not just recent,
Yep.
like going way back, especially in other countries, like what they're doing. And, like since time immemorial, we've been friends with plants, especially the ones that activate our endocannabinoid, that one.
Yes.
You know what I mean.
ECS. When we don't want to say it, we just say
thank you. But yes. And why do you think it's the taboo? You think people are afraid to look, or like what others would think of them if they look?
I think there probably is still some taboo. I think a big issue that NCSBN was trying to solve when they brought out that document in 2018 is that it's not being taught. So it's the largest receptor system in our bodies, and it's still, it was discovered in the 1990s. It still has not hit our textbooks. I mean, once in a while I'll hear from someone that there's something about cannabis in their pharmacology textbook or something, but for the most part, it's not being taught in anatomy and physiology. It's not being taught in pathophys. It's not, mostly. So Dr. Parmalee and I did a study that looked at nursing students' knowledge, attitudes, and skills around medical cannabis. And they're all basically said it's either approached from a negative perspective, from an addictive perspective, or if they're in a state where it's not like fully adult use, their professors will say, no, we can't talk about it. And they're like, yeah, but I'm going to move to a state where it is adult use. Like, I need this information. And so some of it is just this real gap in that lack of education. I think there is some fear that's most likely unfounded around sort of the whole federal scheduling issue. Can patients use cannabinoids in an inpatient setting? Or will that hospital or that hospice or that skilled nursing facility lose their license? So far, that has not happened. And there are some facilities that, and particularly out there in California, there are, you have some rules or laws, I guess, around particularly use at end of life with cannabinoids in the inpatient setting that are fairly protective. Those are state laws, though. There still is the federal law, but nothing has happened around that. So I think there's a lot of fear. I think there's a lack of knowledge. I think we are still dealing with the, reefer madness stigma and people not understanding, and just like, and then also kind of conversely, like, because it's fairly safe, it's like, just go do it. I don't know about that. Go talk to them down at the dispensary, right? And kind of relying on people that are really there to sell product,
Right.
not necessarily to educate and support, instead of us taking on, this role that we should be having here. So
if you're a nurse, what's the feeling you associate with going to the mailbox and seeing that notification that says your license is up for renewal in 90 days? Do you go, yes? Or, oh, right? Why? I mean, it's not like they're hard to get. You have 2 years and there's so much free stuff out there. And yet we drag ourselves across the finish line, kicking and screaming, because they suck. They're boring and antiquated, and the delivery mechanism is inconvenient. And the thing is, if you're a nurse, we love to learn. We're always listening to podcasts and audiobooks and YouTube videos because we're just curious. But we have to pick through this pile of crap so that we can remain a nurse. Well, we created RNegade.pro to change that. We wanted nurses to be able to get credit for the stuff that they're naturally inclined to do anyway. It starts with a podcast. And then we're creating courses, and we want everything we do to feel like what you're naturally doing. The research shows that that's how we learn and retain best. Check it out. Pick one. See what you think. So maybe when you go to the mailbox next time and get that notification, you'll have that, yes.
If it's, when you're talking about like an inpatient setting, if it's legal in the state, can't the patient choose to continue use in a...
Yeah. Every hospital will have its own policy. And it really depends on the state. I think it was either Michigan or Minnesota when they went adult use, and they got together an actual committee of people that were from various different professions in the hospital setting, and they came together and they just wrote 3 different policy levels. One is like no cannabis use in the hospital. The next was like cannabis use in the hospital, but it has to be, locked up and like self-administered and brought to you by whatever. And then the third level of policy was it can actually be held and administered by healthcare professionals. So then they left it up to the hospitals to decide which policy they wanted to adopt. And I think that was actually really effective. So it depends also on the state laws. Like here in Maine, we have really good state laws for medical patients. They cannot be discriminated against in the workplace or for housing for using medical cannabis. Now, I still have heard of patients bringing their medical cannabis in to the hospital and it being taken away. So, there's kind of like the state law, and then there's like the policy, and then there's like, and then how is it actually being managed in those settings, right? So,
my dad was just hospitalized a couple months ago, and he got in trouble for my brother brought him in a flask of bourbon. He was in for sepsis. He's not an alcoholic or anything like that, but he likes to have, like, he's an 85-year-old man. He likes to have his glass of bourbon and whatever. And he was so stressed out. So my brother, and they dumped it out in front of them. They probably wouldn't have done. They
should have called the doctor for an order for that.
I know, but he would not have been, they wouldn't have done that for cannabis. Like if it was at the Cleveland Clinic, and they're very, integrative, holistic, whatever. And plus my brother's a surgeon there, so he probably had it in, but they probably wouldn't have done that for cannabis.
Yeah.
I think it's going to be up to nurses. it's going to be up to the Avengers to dispel these taboos and stuff like that. It's already happening. I mean, the list of Avengers that you just brought out, like Dr. So-and-so, she's from Stanford, my friend so-and-so, shout out, she just got her PhD. Like, woo, I like the circles you hang around.
I think, that those friendships that have developed is, the Cannabis Avengers or whatever.
That's the title of this podcast.
Yeah. Oh, good. Whatever we had like, because of the risks that we've taken as well. And I haven't talked much about that other than like, I've been called a stoner nurse, but I supported, so because of the things we've done, put ourselves on the line, and the hard work that we've done together, we really have formed these great bonds amongst ourselves, and really support each other. But in 2016, I supported vocally and also in writing that I was in support of adult use cannabis in Maine. So the landscape then was like Colorado, and then California, Nevada, Oregon, I think were also voting at the same time, something like that. And so I wrote a letter that went out working with the Marijuana Policy Project that was sponsoring Yes on One in Maine for adult use cannabis. So I wrote a letter that went out to 10,000 different levels of healthcare providers in the state of Maine. And I clearly stated in like 2 pages why it was important. I talked about the endocannabinoid system. I talked about patients being able to access and not having to have a medical card and so forth. And it went out. And I used my title. I was newly tenured at University of Maine at Augusta. And I called myself, associate professor, University of Maine at Augusta. I should have put a disclaimer on there that these were my views alone. I did not do that. And so legal got involved, and I got called into my dean's office. I had people in my colleagues that were mad at me for doing this, and like they're going to try and find a way to fire you, even though you're tendered, and legal's involved. And I was like, what is going on here? So I went in to talk to my dean, and she actually just said, what you did was perfectly fine. It's your right to do that. However, we're getting calls to the university, and the president's being asked what the university stance is, what the University of Maine system stance is. People are saying you should be fired. And she said, so we're just asking you to have that disclaimer on anything you do publicly, and also let us know, like, if you can, as a courtesy, like, let us know when you're going to get so involved. But in Maine, it barely passed. It passed literally by 2,000 votes. But it did pass. And then it took us a number of years to actually operationalize. Like Nevada, they were up in 6 months. Maine, it's like 3 years later, I think, before we finally got it operationalized. So, but yeah, it's and for some people, it will still be risky to bring this into the workplace. There'll still be pushback. I really recommend downloading that article from the Journal of Nursing Regulation and bringing it into work and saying, look, the National Council of State Boards of Nursing says we have to be knowledgeable and we have to be supporting patients. So
there you have it.
Yeah,
that's great.
Exactly.
All right. Well, when did you have anything else?
No, I mean, I had one last question around you, because you spoke a lot about speaking at oncology conferences.
Yeah.
So I was curious around, I know it's been used in cancer for a long time. Mm-hmm. Where else are the other popular, recognized areas of medicine where you see cannabis used pretty frequently?
Yeah. Well, I want to say it's used in cancer because, it's helpful for nausea and vomiting. Sure. It's helpful pain. It helps people sleep. It brings back their appetite. It's kind of like an all-in-one palliative medicine. It's also used really highly by multiple sclerosis patients. Mm-hmm. And I call that the Montel-Williams effect. So Montel-Williams has MS, and he's very vocal about it. And that he uses cannabis, and people trust him, and he's brought a lot of people into using cannabis for MS. And then, we have the CBD use for kids with seizures. When Colorado was kind of like the only state that was adult use, there were many families that moved there. And many of them were bringing their children there so that they could get kids CBD and get it, sort of safely and not feel like they were going to be in danger. And it even split families up, right? So there's stories of people that, lived in Utah, but half the family moved to Colorado so this child could access CBD for their seizures. So that's another big one. And I think athletes too. So, athletes use it to help them recover.
Mm-hmm.
They use a bunch of different cannabinoids for different things. And I think also in general, elderly folks. So elderly folks, and, maybe I'm in that category as I'm approaching my 60s here, but elderly folks.
Well, you're doing very well. Keep smoking whatever you're smoking. I'm just
So elderly folks are generally they have, and I'd have to look up the statistics. I'm assuming it's still true that they're the fastest growing population that's using this. So part of it is because they've had experience with it in the past from their college days or whatever. And part of it is they're dissatisfied. A lot of them are tired of taking 20 medicines. And once they get that endocannabinoid system, upregulated and supporting it with exogenous cannabinoids, they can often decrease some of their medicines or get off some of their medicines.
That's awesome.
So get out of that sort of right? Yeah.
Well, I have one story for you about that got me, I was never anti anything, kind of, but my mom, when she had ovarian cancer, she was 79 years old. Neither she or my dad ever had done a drug in their life, kind of straight. And she went through a gin and tonic phase. She went through a Bloody Mary phase, but that was about it. And it was like half. When she died, she was probably like 72-pound, 4'10" little Italian lady.
Yeah.
She was in so much pain and so much discomfort, not only from the cancer, but she had a lot of trepidation about dying. She was always like, if my mom, if she had a couple drops in the tank, she'd floor it for anybody else but herself. That's how she.
Yep.
So this one time I live in California. My brother's, who's the doctor at the Cleveland Clinic, I had brought some of those ribbons for my brother because they were high dose. So my brother wanted me, I had them in a separate drawer. My brother, who was there with my mom, thought that they were the ones I brought from my mom, 100 milligram ribbons. Now, wait, yeah. So he calls me and he's like, and I didn't pick up the phone, and he's like, he just wanted to do something for my mom. He knew, and she hadn't tried one, and she agreed that she would try one. So he's like, so I just gave her a quarter of one.
Oh, no.
Now I trip on 5 milligram, like a 5 milligram, like I have a strange relationship. I'd rather upregulate my endocannabinoid system, but in a different way, because it's either it puts me to sleep or I trip. Like nothing in between. So he's like, I called him back and he's like, yeah, I just gave her like a quarter of one of those ribbons. I'm like, what do you mean the ribbons? You should have given her half of one of those little T 5 milligram gummies just to test it, because she never had a drug other than alcohol ever in her life. Oh, wow. I don't even like to call it a drug. And you gave her what? He's like, yeah, it's just a quarter, 25 milligrams, teeny tiny lady. And I'm like, well, it's not going to hurt her.
Yep. Might be a long night,
because he was already driving away. I'm like,
the video
turn around, at least prepare her. Mom, you might feel a little weird. Just turn on some Grateful Dead and put her on the couch, Yep. I never saw her face look so young in years, though, in all the years, because she just laid there and she's like, yeah, do we have any popsicles? She was relaxed. She was peaceful. She was out of pain. She was hungry. It gave her the munchies. She finally ate something. And that, I know it's one story, it's one anecdotal, but I'm so grateful for that at the end of her life, she finally discovered it. And she got a huge dose and she was like teeny tiny. And she was like, yeah, like this is awesome.
So just so people know, like ideally when we look at the dosing, or we call it self-titrating, because unless you have an APRN license and you have the DEA, whatever, or if you're an MD or a DO or whatever, then you can quote prescribe and talk about dosing. We talk about self-titrating because that's really what patients are doing, right? So just so people know, like we recommend people start at like 1 milligram of C if possible, see how that feels.
Not the heroic dose.
So I have also heard stories of patients. So hospice patient out in Colorado goes to the dispensary, says, I'm looking for stuff to help me, get out of pain and whatever. Same idea. Here's 100 milligram candy bar, but only eat half of it. So this older guy who's probably fairly frail on hospice takes that advice, eats the 50 milligrams, has a terrible experience. So your mom had a great experience. But most people, if you give them that amount, and I'm more like you, Karen, I'm like 1-2 milligrams, like that's it for me. So anyway, he had a terrible, he thought, so people can get to the point of where they might have like some oral hallucinations, throwing up, diarrhea, feel like they're going to die, super high anxiety, kind of like, not good, right? They may think they've overdosed. Again, remember, they can't really overdose.
Right.
This guy then like gave up, right? Because he had such a terrible experience. He never used cannabinoids again before he passed away. So another good reason why it's so important for people and nurses and patients to really have this knowledge of, we call it starting low and going slow. So starting real low on that THC and then gradually increasing the dose over time till you find what we call the sweet spot, where you have relief of symptoms, but you're not having any adverse effects. And that's really a goal we would have as being a cannabis nurse, is supporting people as they do their self-titration to find that sweet spot.
Is it like anything else where there's lowered sensitivity of the receptors, do you develop a tolerance for it?
So most people do develop a tolerance over time. And also people can have withdrawal symptoms when they stop taking it. And they're pretty minor, it's not like most people are not going to have to go inpatient somewhere. Occasionally people that were on higher doses, or have other things going on may struggle, but it's usually like caffeine withdrawal is the closest thing that I could describe how most people would probably go through withdrawal. So like, which is no joke. If you've ever used coffee,
that's pretty intense.
Like I used to drink 5 or 6 cups a day, and then I stopped, and it was for like 8 days. It was terrible. But anyway, so cannabis withdrawals are very similar, like night sweats, increase in like nightmare or very intense dreams, anxiety, kind of having a desire to use the medicine again, right? A rebound and maybe what they took it for, if it was pain or what have you. But for most people, those will last, 1 to maybe 2, 3, 4 weeks. Some people may have extended issues. But again, it's also looking at the individual and what's going to work for them. And we really don't have any good meds to really help with that, other than, maybe focusing on tapering back.
Yeah, I'm sorry. I meant to let you go 10 minutes ago, and so thank you for
okay.
thank you for giving us some more time. But you just gave me another question. Wouldn't it help to mitigate the withdrawal symptoms by doing something else that upregulates the endocannabinoid system while you're withdrawing from the plant?
A CBD?
So
or nothing at all, or exercise, or whatever else.
So I think CBD could be fine and maybe helpful. There's also some other cannabinoids that might help, like CBG. But yeah, exercise, yoga, meditation, getting enough sleep, eating well, like all those things would definitely help with some of that.
So common sense. Common sense helps to mitigate the symptoms of withdrawal.
Staying hydrated, right?
Yeah. Oh my gosh, this was just a wealth. I could keep you on for another couple hours and go down the other things. And let's do another. Let's do a series
Yeah.
to it sometimes. This
Yeah.
was just scratching the surface, but it's so helpful as an introduction to nurses who really want to know about this stuff.
Yep.
Yep.
And you're such a delightful, approachable delivery mechanism for the information. So thank you so much for your time. If nurses listening to this would like to get a hold of you, if they have specific questions, if they go out and buy your textbook, like I'm about to do as soon as I get off of here, how do they get a hold of you? And are you open to answering questions?
I am open to answering questions. So the textbook is Cannabis, a Handbook for Nurses. Wolters Kluwer is the publisher. I also recommend checking out American Cannabis Nurses Association. It's the 501c3 and working hard to get that certification test in the future so people can be certified cannabis nurses. Also, American Holistic Nurses Association is a great ally there. I teach at Pacific College of Health and Science currently. I am in process of relocating, though. I'm going to be teaching at Binghamton University in Binghamton, New York, where I hope to restart a new, probably cannabis certificate there. And so if you want to reach me, probably the easier, I have a couple different emails, but so I will just say drcareyclark@gmail.com. So that's Dr. Carey Clark at gmail.com. And I just give you that one because also the textbook is under my old name, which is Carey Clark, not Carey Cadieux. So drcareyclark@gmail.com and you'll find me. And you can also just reach out to me on LinkedIn too. I think that's how you found me, right? So
Yeah, it is.
Oh, well, Dr. Carey Cadieux, thank you so much for your time. This is and if we can do anything to support you in your work, please let us know. It's so important that there's people like you out there. And you, like I said, you are the perfect delivery mechanism between the credibility of academia and just the cool approachability of a really good teacher with some good stories and good communication skills. So thank you so much for your time today.
Well, thank you, Karen and Wendy. It was my pleasure to be here, and I look forward to part 2.
Yeah, I do too. Thank you.
Thank you.
Take care.
Bye-bye.
Bye.
Bye.
Renegades.